morning, everybody. Get this kind of started. Today we're covering just Medicare 101, going to go over some of the Medicare supplements, Medigap plans. What are they? What exactly? How to, some benefit information in there. So to kind of kick off as a review, if you've been on the previous weeks, kind of our family tree, how we're all set up. National General is the parent company to AHCP, VeloPoint, HST, Healthcare Solutions Team, as well as recently we've had an acquisition with Agent Cubed, as well as Health Compare, which Health Compare is what brings us all together for Medicare and all those Medicare carriers to be able to extend that out to you guys. Really, what are we all here for Medicare? We want to be able to help people out and get them set up with some great plans that's going to really benefit them in the long run. So overall, just to kind of go over some of the agenda, what is Medicare Supplements, Medigap? What do you need to know about it? The benefits, how it works, some of the enrollment periods to it, the costs, plans, and reviews. So Medicare Supplement Insurance, or Medigap, is private insurance companies that help pay for some of the out-of-pocket costs not paid by original Medicare Part A and B. There are 10 plans standardized by the federal government, which is labeled with letters, kind of the ABCs. This kind of brings in more alphabets for you guys to kind of memorize and learn which ones are what. And all plans with the same letter offer the same benefits, but not all plans are available in all states. So original Medicare plans pay for mainly health care services and supplies, but it doesn't pay all the person's health care costs. Medigap policies and health insurance policies sold by private insurance companies help fill that gap in coverage under Medicare, original Medicare plans like deductibles and co-insurance and co-payments. So some Medigap plans also cover benefit that Medicare may not cover, like emergency health care while traveling outside the United States. We've talked about original Medicare plans. Now let's kind of cover some of the Medigap. The insurance companies that all sell these policies must follow federal and state laws that protect people with Medicare. The Medigap policies must be clearly identified as Medicare supplement insurance. So if you're going through and helping your beneficiaries get set up with these plans, you need to make sure that you are clearly identifying to that beneficiary or that customer that this is a Medicare supplement insurance. A Medigap policy only works with the other cost sharing under your Medicare plans. So to be eligible to enroll in Medigap plans, you must be enrolled in both A and B and reside in the plan service area. Be aware that each Medigap plan covers only one person. So if it's a husband and wife, each one of them has to be set up with a separate plan. Because Medigap plans are offered by private insurance companies, the cost and availability of each lettered plan may differ. Not every insurance company offers all 10 plans, and some popular Medigap plans types are more comprehensive than other plan types. They cover basic benefits and may also cover some foreign travel emergencies and excess charges. So supplement insurance companies are sold to cover what Medicare doesn't. Supplement policies do not usually cover any medical services. They help, like I said, in regards to filling, that co-payment and co-insurance as well as deductibles. So just kind of going over things to know about Medigap policies. Medicare Part A and B, a must. They have to leave that Medicare Advantage plan before their Medigap policy begins. So if they're on that C plan, they have to leave that before they can have that Medigap policy starting. And they pay for Medigap policies in addition to a monthly premium, or I'm sorry, they have a monthly premium as well as that Part B premium. So you need to also, make sure that your customer or client is aware that they will have two premiums that they're going to be paying. And again, as I said, those policies only cover one person in the household, so each person would need to have their own plan. Any standardized Medigap policy is guaranteed renewable even if you have health problems. This means the insurance companies cannot cancel the Medigap policy as long as they've paid their premium. And some Medigap policies sold in the past cover prescription drugs, but Medigap policies sold after January 1st in 2006 are not allowed to include prescription drug coverage any longer. So maybe if you speak to any of your clients and they maybe are a little bit older client and talk about in the past how they did have that prescription coverage, unfortunately it's no longer available. It's illegal for anyone to sell Medigap policies if they have that Medicare Medical Savings Account plan as well. So you got to make sure that they are not on a Medicare Medical Savings Account plan. So just kind of jumping into the Medicare supplement, Medigap, kind of depends on the agent who's working with them or with the client and what they want to call it. If they want to call it Medicare supplement or if they want to call it Medigap, they're both the same thing. Again, it does help fill those gaps left over from the original Medicare. It helps pay those deductibles, those co-insurance, and those co-payments. It does offer some medical care received outside of the U.S. So for those foreign travels, it does. And they must follow those state and federal rules. Each state will have their own jurisdiction that may offer some additional protection or laws that you have to just double check and make sure that you know what your state laws are in that regard. Must be clearly identified as that Medicare supplement insurance. As I said, make sure that when you're talking to your beneficiaries, they're fully aware this is supplement and not Advantage. And be aware that the companies may charge different premiums for the same exact Medigap plan. Maybe, if you go through Medicare supplement carrier, you have a couple different that you're contracted with, they may not always charge the same exact premium. So you want to make sure that you're going through getting that customer set up with, something that's going to definitely benefit them, fit their needs, and also make sure that they're aware of the premium costs. And then there's 3 types of pricing per carrier and state. You have your community, depending on where they're at, it's the same price regardless of their age. And then you have the issue age. It's not nearly as common for the carriers to charge on the issue age, but it's more common for them to go ahead and charge at the attained age. So definitely need to make sure that you are paying attention to the pricing in that regard. And people can buy a Medigap policy within 6 months of enrolling in their Part B. They must be 65 or older. If they lose certain kinds of health coverage through no fault of their own, they can also have it. And if they leave a Medicare Advantage plan under certain circumstances, they definitely have the opportunity to buy a Medigap policy. And whenever the company will sell them one as well. There's different points of time when it will be guaranteed issue versus other times, and we'll cover that here in just a little bit. And then also please remember, again, it does have a monthly premium. So as I said, if they have that premium for Plan B, they'll also have the premium for the Medigap plan. So there's, the additional cost there. And generally, they can go to any doctor or specialist without having to have that referral. So that definitely makes a difference in that regard as well for your customers if they're not wanting to, worry about having those referrals. So kind of looking at a chart of just how it's laid out, you have your Part A and or Part B. And then step 2 is decide if they need that drug coverage or not. And then you can kind of go into, if they do want that drug coverage, then, you have that Part D prescription coverage. And step 3 is just deciding if they need additional supplement coverage. If your customer is looking for that additional coverage, then they can go ahead and have that Medicare supplement insurance. The beneficiary must have that Part A and B to buy that Medigap policy. So easy little chart to kind of lay out how you're going to decide if they need that or not. And then your enrollment periods for Medigap, this kind of jumps into a little bit more about how I had talked about there are those opportunities for guaranteed issue. You have, the best time for them to purchase Medicare supplement insurance is during their Medigap open enrollment period. It lasts 6 months and begins the first day of the month in which they are 65 or older and enrolled in Medicare Part B. So kind of an example of that is if they turn 65 on April 3rd, but they don't join Medicare B until May 25th, their Medigap open enrollment period will start June 1st, which is the first day of the month in which they are both 65 as well as enrolled in Part B. Okay, does that make sense? So you got to have those little, those little two things there. It's a month after, and then when they both have that, Part B and 65. So Medigap insurance companies are generally allowed to use medical insurance underwriting to decide whether to accept the beneficiary application and how much to charge for the policy. But during their open enrollment period, an insurance company cannot do any of the following things. If they have disability or health problems, they cannot refuse to sell that Medigap policy. It is during their open enrollment. It does make it guaranteed issue. Now, if they were to go outside of their open enrollment and try and get set up with a Medigap policy, it may not be guaranteed issue. So they may have those underwriting questions that they have to go through and pass, and if they cannot, they may actually at that point in time be declined for a policy, depending on the circumstances. And then also, they can't delay the start of coverage, and they cannot charge a higher premium than they charge others who are, at 65 or older. So that's during their open enrollment period. For possible pre-existing conditions, waiting periods, they do have a possible waiting period that they have to go through and do. Although insurance companies cannot delay the start of their overall coverage during the open enrollment, in some cases, it may be able to make them wait for coverage related to a pre-existing condition. So they might have to, have a small waiting period that they have to go through and wait for coverage on. To kind of look at how it works, each standardized Medicare supplement insurance covers different types of out-of-pocket costs. So the beneficiary will pay an out-of-pocket cost depends on what service they use and which plan they have. So this is, it gets a little confusing, so let's kind of use an example. Suppose a person has original Medicare A and B and receives the following covered services: 15 days as an inpatient in the hospital, 22 days in a skilled nursing facility, and 2 visits with a doctor who doesn't accept Medicare assignment. So, you got to make sure that they're set up with, a plan that's going to kind of fit their needs. So if you look at kind of the out-of-pocket costs down at the bottom, if they had no plan at all, it's going to cost them $1,702 without having any coverage. And that's including their if they had a deductible for a benefit period, and then the co-insurance for the skilled nursing facility for over 20 days, and that's $330. For Part B, co-insurance for 2 doctor visits, which is, remember, I told you it's an 80-20 type plan, so you have 20% of that Medicare approved amount. And then for Part B, access charges for the same doctor visits, 15% of the reduced approved amount is $24. So total out-of-pocket cost for that beneficiary, if they had no plan coverage, would be $1,702. Now, say they decide to go ahead and have the Cadillac Plan, which is Plan F. It's the most comprehensive plan. If they went ahead and had that 15 days inpatient in the hospital and had the 22 days of skilled nursing and the 2 doctor visits, what are they going to be paying out of pocket? Total out of pocket is going to be $0. They have that most comprehensive plan, but please remember they do have that monthly premium amount they still would need to cover for their Plan F. So Plan A, deductible for benefit period. Plan F is going to help with that deductible. It's also going to help with the co-insurance for the skilled nursing facility. It's going to be $0 out of pocket for them. For Part B, co-insurance for those 2 doctor visits is going to be $0 out of pocket for them as well. Same with Part B, access charges for the doctor visits, $0. So total out-of-pocket cost for that customer is going to be $0 if they had a Plan F for the scenario. So plans having, different letters and, for example, Medigap Plan L and Medigap Plan M, they have different levels of coverage. So plans having the same letter names, such as Medigap Plan L, include same coverage no matter where you buy them. So if you go through and have an Aetna supplement that is a Plan L, as well as you have maybe Mutual of Omaha that has Plan L, they're two different carriers, but it's the same plan. They're going to have the same coverage. They may not have the same cost of premium. That's where it may differ. There are 10 standardized Medigap plans by the letter A through N in 47 different states. Please realize that Massachusetts, Minnesota, and Wisconsin do have their own standardized Medigap plans. So to take a look and at kind of the chart of how things break down in regards to the A, B, C, D, F, G, K, L, M, N plans, and the coverage that they're going to help in regards to the coinsurance, copayments, and deductibles. To just kind of take a look, if going across the chart, skilled nursing facility, the plan A and B don't help at all. But if they had a plan C, it's going to help 100%. For Medicare Part A deductible, if they have a plan K, it's only going to help 50% in that regards. So it does really help various different plans for various different coverage of the coinsurance, and deductibles. You just have to make sure that the consumer client is aware of what it's going to be helping with. So some of our top selling Medigap plans that people are very familiar with. Plan F, like I said, it's the Cadillac plan, the most comprehensive plan. It has basic benefits. It helps with 100% with the coinsurance for Part A, 100% for the coinsurance on Part B, as well as covers the first 3 pints of blood and helps with hospice. Now Plan G, which is just a little bit less than coverage than Plan F, that does help 100% in those areas as well. And then you have the skilled nursing facility helping with the coinsurance. Plan F helps with that. Plan G helps with that. Plan N helps with that. And then you have your high deductible Plan F as well. And then you have excess Part B charges. And Plan F will help with those. Plan G will help with those. Unfortunately, N does not, neither does the high deductible Plan F. Excuse me, one moment, I have a tickle in my throat. I apologize. Okay, so kind of taking a look at it, you do have foreign emergency travel or a foreign travel emergency. Plan F will help, Plan G will help, Plan N will help, and Plan high deductible F will help in that regard. So what isn't covered by Medicare supplement insurance? Well, pretty much standard rule of thumb. We know that if it's related to Medicare, long-term care is not covered. It's something that they would have to have a separate policy on. So rule of thumb, no long-term care. Routine eye exams or eyeglasses, routine hearing tests or hearing aids, routine dental exams and cleanings or x-rays, private duty nurses, and days in a skilled nursing facility beyond 100 days covered by Part A. Now with these, for certain Medicare supplement plans, some of them will have riders in there. So you need to double check and make sure if they have a rider in there that might help in regards to some of the eye exams or hearing tests or dental exams. So the Cadillac plan, Plan F, let's kind of cover some of the things that they have available. So Medicare Part A, coinsurance and hospital costs, it helps cover it. Medicare B, coinsurance and copayments, it helps cover it. The first 3 pints of blood, it does help cover that again. And as I said, this is the most comprehensive plan. It is available in most states and usually does have a little bit higher cost to it. If you visit the hospital frequently and rack up charges for doctor visits, Plan F would eliminate those out-of-pocket costs. So definitely it might be something beneficial for your customer, depending on their circumstances. Plan G. Plan G is the most popular by Medicare supplement plans because it does offer the second most coverage out of the supplement plans. It might be a little bit less expensive than the Cadillac Plan, Plan F. It also covers your coinsurance and hospital costs with Medicare A. It also helps cover with that Part B coinsurance and copayment, except for $20 for some office visits and $50 for ER visits. It covers those first 3 pints of blood as well, and it helps out in regards to the Part A hospice care and coinsurance and copayments. What's not covered is it's not going to assist with that Part B deductible. But otherwise, it really helps out, in a lot of the other areas, same as Plan F. Part N is usually the least expensive of those 3 plans, but it does not cover the Part B deductible or co-payments for doctor and emergency room visits. As you know, Plan F covers most and has most expensive monthly premium out of the 3 plans. And then G has less expensive premiums, but does not cover that Part B deductible. And now you have Plan N, which is the least expensive of those 3, as I said, but it does not help with the excess charges or that deductible in Plan B. Plan M is one of the popular Medicare supplement plans because it often has a lower monthly premium while it still offers a decent amount of coverage. Plan M was crafted as an option to allow Medicare recipients to trade a little more exposure to the medical expenses for a little lower monthly premium on their coverage. So, it will help with 50% of that Part A deductible. It does not help with the B deductible, and it does not help with the B excess charges. Again, it does have, the $20 for some office visits and $50 for the ER visits. And then kind of jumping into Plan C. Plan C, remember this is separate than Part C. This is Plan C for Medicare supplement coverage. It covers all the basic Medicare benefits, including Part A hospital coinsurance and Part B deductible. It has preventative care coinsurance, and it covers quite a bit of the rest. It does not cover that Part B excess charge. Plan A. For Medicare, supplement Plan A, it's the most basic of Medicare supplement insurance plans. It covers the coinsurance associated with a hospital stay, provides additional 365 days of coverage in the hospital during their lifetime, but only while on the policy. It covers the coinsurance and copays associated with the Medicare Part B, which is the outpatient benefits. And it also covers the first 3 pints of blood. Medicare covers anything after that. And then the copay and coinsurance for Part A hospice care as well. It does help in that regard. I'm not going to go through all 10, but I do want to go through some of the more popular ones, more frequently used plans. So this will be the last plan we cover, is kind of the middle plan, Plan D. Please do not confuse this with Part D. Prescription coverage Plan D is completely separate. It is the middle plan in terms of coverage. Medicare Supplement Plan D is Medicare Supplement Plan that private insurance offer to cover those gaps in the basic Medicare coverage. Unlike Part D, Medicare Supplement Plan D does not have that prescription drug plan. As I said, those are no longer available with Medicare Supplement plans after 2006. So, but overall, this really helps out in the regards of the coinsurance and copayments. It does help with the Part A and Part B on those. And then it does help with the Part A deductible. It does not cover the Part B deductible, and it does not cover Part B excess charges. But it does have that 80% coverage for foreign travel emergency. And then a table to show the types of costs a beneficiary may have with Medicare supplement insurance. They need to look at individual plans to understand their specific costs. So the premiums. Plan premiums can vary from company to company, as I said before, even for the exact same coverage. So you have to kind of do a price comparison for your customers, make sure, that they are getting set up with a plan that's going to fit their budget. The beneficiaries will continue to pay that Part B premium as well. And then deductible wise, the beneficiaries may pay Part A and Part B deductible with some of the different Medicare supplement plans. As you saw, there's quite a few plans in there that do help out in regards to those deductibles. And then the high deductible Plan F has an annual plan deductible. So that does, that's the high deductible Plan F. So there is an annual deductible on that. For co-insurance or co-payments, the beneficiary may pay a set co-payment for covered Part B services with some Medicare supplement plans. And with the coinsurance, the beneficiary may also pay part of the coinsurance amount for Part B service with some of the different plans available. So like I said, it's just kind of knowing the differences of the plans, if it's going to help them out with that coinsurance and deductible and co-payments. And then the Medicare supplements, the difference between the requirements. This is, a little bit of difference between the Medicare Advantage requirements to the Medicare supplement requirements. For Medicare supplement requirements, you need to have your carrier appointments. You do need to have your anti-money laundering certificate as well as training product certifications, oh my goodness, depending on the carrier. So some carriers do require you to complete their own certificates. If you're already appointed, just go into your agent portal and see if they have something in regards to completing a certificate. Or they'll send out some sort of marketing information or email to you, letting you know if you want to participate in selling the Medicare supplements, there are certain things that need to be completed. For Medicare Advantage plans and prescription drug plans for the Part D, you do need to make sure that you have your AHCP certification completed, as well as you still need to do your fraud, waste, and abuse training. And then, again, certain carriers do have their own certifications that you have to complete. So there is a little bit of difference in regards to selling Medicare supplements to the Medicare Advantage. If you want to do it all, definitely you have that opportunity to go through AHCP, and there's additional training in there that you can do after you get your normal training out of the way. So just kind of taking a look between the differences of a Medicare supplement plan to a Medicare Advantage plan. Doctors and hospitals, well, with a Medicare supplement plan, you don't have to have the referrals. You can select any doctor and hospital as long as they accept that Medicare. For Part C, if you were to have Part C instead and not the supplement, they may be required to have to use that doctor or hospital within their network. So there's a little bit of difference in that regards. With referrals, they don't have to have a referral, usually if they have a Medicare supplement plan. For Medicare Advantage plans, Part C, usually they will need to have a referral to use that network specialist. Is there a network restriction for Medicare supplements? Not usually. Coverage, kind of goes wherever they may travel in the United States. With Part C, if they were to have the Medicare Advantage plan, they usually will have network restrictions. So you have to kind of make sure, you're checking with your client if they tend to travel or not. And enrollments, what's the difference with enrollments? Well, with Medicare supplements, you can apply to buy a plan anytime after they turn 65. They don't have to do it immediately. But again, as I said, remember, if they do it during their enrollment period, then they do have that guaranteed coverage, and it's, best available rate, regardless of the health status. With Medicare Advantage plans, generally there's a specific period during the year that they can enroll or switch to that different Medicare Advantage plan. So they do have a little bit more restrictions on the time periods that they can do that. You can't be denied coverage or charged based on the health status with Part C either. So, you want to make sure that if your customer is getting set up with that Medicare supplement plan and that they want that guaranteed issue, definitely try and have them do it during their enrollment period when they get set up with that, join that Part B. And for costs, there is a monthly premium in addition to the Part B premium when you use the Medigap services, and the out-of-pocket costs are limited. Okay, with the Medicare Advantage plan, generally there's a low or zero monthly plan premium in addition to the Part B premium. When they use the services, they pay a co-payment, co-insurance, and deductibles up to a set amount out-of-pocket limit. And for prescription drug coverage, as I said, usually prescription drug coverage is not covered in Medicare supplements. They may consider adding a Part D plan to that if they have a Medicare supplement. Now, if they have the Medicare Advantage plan, prescription drug coverage is usually included with the Medicare Advantage plan as built in. So just kind of a review, going over some of the different things that we covered. Trying to keep it kind of short and sweet today if possible. There's different insurance companies that can sell same Medigap plans, but please remember there are different amounts depending on the company. The plans may be completely the same, but the premiums may be completely different. They must already have that Medicare Part A and B to be eligible for that Medigap policy. And the best time for them to buy that Medigap policy is during their Medigap open enrollment period. That's where they'll go ahead and have that guaranteed issue, not have to worry about that medical underwriting. They can go ahead, get signed up with Medigap policy at any time during the year, but if it's out of their enrollment period, then they may have to go through and have those medical underwriting questions, and they may not be eligible. Outside of the Medigap open enrollment, just kind of remembering, as I said, they may have to have that underwriting. They may not get actually qualified for that plan. So definitely try and keep it during their open enrollment period if you possibly can. And if they can't have a Medigap insurance and Medicare, and they can't have Medigap insurance as well as the Medicare Advantage plan at the same time. They cannot have a Plan C as well as the Medigap, or Part C as well as the Medigap. So please make sure that if they are currently on a Medicare Advantage plan Part C, they do not get set up with Medigap insurance. And every Medigap policy must follow their federal and state laws designed to protect the customer. And the policy must clearly identify itself as a Medicare supplement insurance. So remember, when you're talking to your clients or beneficiaries, that as you're going through covering the plan details, that you definitely are letting them know that this is supplement insurance. And as of today, remember, Medicare supplement insurance does not cover that prescription. So if they have A and B, they might want to go ahead and get set up on a Part D, if they need to have that prescription coverage in there. And any questions, definitely, again, please feel free. You can always reach out to training@ahcpsales.com, and just kind of going over, some of the questions that have popped through on, while the training was going, the presentation was going. What if the client wants to maintain a Advantage plan but wants coverage for the foreign travel? That's a good question, Raymond. Some of the Part C will have a little bit of foreign travel to it. You have to just double check if in their Part C plan, if it has that foreign travel. They might be able to, have some coverage. And then definitely, I had somebody ask in regards to, getting copies of the presentation. Most definitely, please send me an email at training@ahcpsales.com requesting it, or go ahead and just, send me in the chat that you want a copy, but please include your email address so I can send you out the copy of the presentation. I'll definitely get that sent over to you. Another question here. Okay, so during the annual enrollment period, with someone currently on Medicare Advantage, when do they cancel and when can they enroll in the Medicare supplement plan? Perfect. So Raymond, I'm actually going to have a training next week. I don't have it on the books yet. I have to send it to my marketing gentleman, but I'm going to be covering all of the different enrollment periods. When they can get disenrolled, when they can get enrolled, your special enrollment periods, all of that. So that actually will be covered in next week's training. If you want to join us next week, definitely it's something that I'll make sure that we have covered in the presentation as well, okay? And most definitely, Mike, I will definitely get this sent over to you. I appreciate you sending me your email address. Thank you. Sure, no problem. I definitely will, Joey. Anyone else? Perfect. Yeah, definitely. I will get the presentation sent over. I do appreciate it. And again, as I said, you guys can always send me an email if you come up with any additional questions, any questions during your AHIP training or your certificates, whatnot. I'll see if I can definitely help you out in that regards. Please make sure you're getting your carrier appointments done as well. Don't wait. We are definitely approaching where the carriers are going to start getting backed up tremendously. With getting people appointed. And if you want to be appointed in time by October for the annual enrollment period, you want to make sure you get your carrier appointments completed and that you can reach out to the contracting team at AHCP and they can help you out. My email address you can send to training@ahcpsales.com. And I can definitely answer any further questions. I can get you guys, if you want to request the presentation, I can get that sent over to you. Or as I said, if you just need some additional basic questions in regards to your carriers, your certificates, your different things that you need to make sure that you have set up and in line, I can help you out in that regard as well. Well, thanks, guys. We were able to keep it kind of to about 40 minutes today. Good timing. I appreciate your time. As always, these are recorded. They are put up on the AHCP sales website under the training. So please feel free if you want to review it, go back over anything. I know sometimes just kind of zoom past certain things that maybe want to further review on. You can always view that at the AHCP sales website under the training library. Our marketing gentleman usually has it up within about 48 hours to 72 hours. So give him a day or two to get it set up. And I'll go ahead and get everything sent over to him today so we can get that up as soon as possible. But I want to thank everybody for their time today. You guys have been fantastic. Some great questions, and definitely I appreciate the request for the presentation. I'll get that sent over to everybody. You all have a fantastic week, and I look forward to hopefully seeing you all next week on the continuation of our series. Thank you so much.